Hi, sir. Welcome. So, could you please tell us about yourself? And
Uh,
yes, sir.
I'm, doc- I'm Dr. Raj Shah. Uh, I'm a medical graduate from India, Baroda Medical College, and trained here at University Pennsylvania from 1970 through 75, and has been practicing as a cardiologist even to date, 47 years in Philadelphia, Pennsylvania, United States. Uh, in addition to cardiology, I am passionate about uh, technology, bringing technology to improve patient care. Uh, and I have done that all my last 50 years since I was in training at University of Pennsylvania. Uh, I have been associated with Will's Global Foundation since last 2 or 3 years, 3 years, uh, and I'm the chairman of the Health Council of the Wills Global Foundation. As a member of the Health Council, I have created a program to bring healthcare access to villagers, and that has been my main goal is to get the healthcare access to villagers which don't have anything. I understand the government of India has primary health centers and sub health centers all over the country. Uh, I think the number is total about 80,000 to date, and they want to increase to 150,000 by 2025. However, almost one third of them don't have a doctor, and we have 600,000 villages. So for every 6 or 7 village, there is only one center. So many people are without healthcare. So that has been my passion, and that's what uh, uh, brings me to uh, work as a board member as well as the chairman of the Health Council with Wills Global Foundation. Wills Global Foundation was inspired by late President Abdul Kalam in 2006 when he presided over the Penn IIT convention. Uh, and inspiration was that all it was initially to IITians uh, that you have been educated by resources from Government of India, Indian Institute of Technology, and for that matter, all the medical schools are heavily financed by Indian taxpayers. And your success, to a great extent, depends on the education you receive. So even if you are not in India, you still owe to do something for uh, your mother country. And I think that led to the formation of Wills Global Foundation. The Wills is acronym which stands for 6 areas in which uh, the organization, it's a not-for-profit organization, work to bring technology leverage solution in 6 areas: water, healthcare, education, energy, livelihood, and sustainability. So that's what Wills is uh, all about. And healthcare is the area which I uh, am the chairman, I lead. I've created a council for almost 50 members from very well known leaders in healthcare in India as well as in USA. So that's who I am and what I do.
That's great, sir. Very inspiring. And talking about this Ideal Village conference, so can you just tell us about your healthcare mission for rural India and your involvement in it?
Ideal Village Conference was started by Stanford Ideal Village program, Stanford University. And last 2 years, Wills Global have joined them. So it's a combined effort of Stanford, Wills Global, and Johns Hopkins University uh, to bring about awareness, bring about all the stakeholders in all these 6 tracks on a common platform to to make a holistic approach. And this year's conference we have named uh, rural transformation for sustained growth, because globally almost more than half of the people they are in rural areas, and in India almost 70% of our population they live in villages. Now, if we want to realize a sustained growth, we have to take care of these people. And in order to do so, of course, our present government has done amazing work in bringing about the transformation. The villages have to be transformed. We can't just have one area or the other in a silo to be taken care. Maybe water, sanitation, healthcare, industries, etc. We need a holistic solution where everybody come together, because for our sustained growth, we need to have villages almost transformed to a level of urban area, because you need all kinds of facility for people to stay there, to to work there, to raise their family, etc. Because what happens is, even villagers, I come from village, those who get educated, they actually migrate towards the urban area because there is not enough work for them. There isn't environment for them to work. They don't have facility and resources to do that. They don't have housing and education facility to raise family. So naturally, they have opportunity and they move out from villages. So how do you keep them in the village? This is how we can do it, by transforming it, taking care of all these areas. And that's our attempt to bring it to the uh, national and international forum, whereby stakeholders can come, they can talk about their vision, they can talk about the projects and things that they have done, what they have learned, what are the best practices, how that can be incorporated. So it becomes a combined effort of all the NGOs in different areas that they work, combining NGO partner with government. So it is a public-private partnership where all stakeholders come together. That's our grand vision. And that's what this Ideal Village Conference is all about, which will be held on November 11th, 12th, 13th at the Banaras Hindu University, BHU, in Varanasi. Uh, we are hoping that our Prime Minister will inaugurate, and Chief Minister Yogi will be in person. And there are many visionaries as well as thought leaders, and those who have actually done and are doing uh, the things to uplift villages for sustained growth will be there to address and share their vision.
Okay. One of your focus area is telemedicine. Why and how it is going to be applied?
Uh, come to think about how we can bring healthcare to villages. We know that there are no doctors, there are
Right.
no healthcare providers. They don't have clinics or health centers. Of course, there are health centers, but it is far from where they live. And as I told you, there is usually one health center for population of about 30,000. So almost a, a 7 or 8 villages have one center, and it is very difficult for them to go there and access care. Yes, care is available, it is free, but they can't get there. They can't receive that. And as I told you, at least one third of them, they don't have the facility, resources, doctors to do that. So, how to get the healthcare? I would say the first thing that is needed is access to the healthcare provider. We are not able to bring doctors in the villages. Yes, often we have a van, we have uh, health camp, but it's only episodic and only happens once in a while. There's no continuous availability of healthcare providers. So, how to do that? If you want to create a clinic and a doctor in every village, 600,000 villages, then this, it's a mammoth task. And even if we build the physical infrastructure, it is, we don't have the human resources, the doctors and the healthcare providers to provide care at the present time. So best way is how we can leverage bringing healthcare providers from city and areas where they are to bring them to villages. Well, the technology come to the rescue. We can use the modern technology to bring them to see the patient online, and that's telemedicine. The technology, which was very expensive maybe 20 years ago, now you can say our WhatsApp and FaceTime and other video visit is free.
Right.
So we can leverage the technology. We can get the physicians to see the patient. Now, one thing that is needed in villages is that they all need to have that hardware. They need to have a smartphone or a phone for them to connect to the healthcare providers. Um, Anchal, you know that e-Sanjeevani,
Mm-hmm.
which is a great program started by our government,
Right.
which allows anybody to get a free consultation with doctor, and they have done amazing work. However, in order for the patient to receive that, they need that phone, they need that smartphone, and if they don't have it and they
Also the
cannot afford it,
awareness. Yeah.
they cannot, because look at this, uh, the household income of a rural population is less than 100 or 120 rupees a day. They
Right.
can't afford a smartphone paying 3 to 400 rupees a month just to be able to receive that. So what we did, we created something similar to a phone booth.
Oh,
We provide the hardware to a resident of that village, along with a few basic devices that can take their vitals like blood pressure, pulse ox, oxygen concentration, temperature, and some point of care testing. So we we donate this what we call kit hardware devices to and train the villager to just basically input the data. Now they have this thing available. Patient can be seen, triage, and that healthcare worker, what we call telemedicine operator or sahayak, he or she can connect with the remote doctor, and this way the villager gets the first step,
right.
access to healthcare. That's what telemedicine that we have created. we have created uh, so-called telemedicine centers, which is essentially a kit, hardware kit, which is donated by Wills Global Foundation from the generous donations received from people in USA as well as in India. And we uh, buy these kits and we give it to we train the resident of the village and give it to the person, and they connect with the doctor. Now, in working of this thing, there is an operating cost because we give the donation, but Wills Global is not a funding organization. We do not have deep pockets to continue providing the physicians and the salary of the helper, maintain the software updates, etc. So for the operating cost, we charge a small fee to the patient, about 100 rupees, of which 50 rupees goes to the doctor for his 5 to 10 minutes of consultation time. I understand that's not enough, but there are many physicians who would like to sort of give that kind of a charity service to the villagers. So they're okay to take that. And remaining 50 rupees, we give 25 rupees to the villager who's the resident or telemedicine operator, and remaining 20 rupees goes for the support of the hardware, software, etc. So in this way, at a very minimal cost, villagers can access healthcare.
Wow, that sounds amazing. And what are the challenges, results, and lessons of these telemedicine program you have noticed so far in India?
Uh, we started our program in Anandpur district of Andhra Pradesh. Uh, we partner with NGOs, the local organization. There we partner with RDT Foundation, started by Vincent Ferrer, uh, a Spanish immigrant of Andhra Pradesh almost 100 years ago. And his son, Moncho Ferrer, is running this. They have created Ideal Village and they provide free services through 3 hospitals. So we partner with them. We started this program helping Chanchu tribe people in 6 villages in Anandpur district. And during COVID time, we partner with Mission Samruddhi and Jivika and other NGOs in Bihar, Chhattisgarh, Maharashtra, Madhya Pradesh, Uttar Pradesh, uh, Gujarat, to form an alliance with them and create a total of almost 300 telemedicine sites in 300 different villages. From the donations we received during COVID time, generous donation of almost $500,000, we're able to create these sites. We served more than 15,000 patients free of charge. However, we have to, now that COVID is under control, we have to transition to the small fee for its service. Uh, the, the response we got was amazing from patients. Uh, the feedback was great. We have prepared a report by New York University, a global uh, health program uh, MPH class, and will be presenting this report at the Ideal Village Conference, which is need for telemedicine services for villages. The lessons learned, the difficulties that we had, of number one was connectivity. Some villages are so remote, there is no
Internet.
even internet connectivity or even a cellular connectivity. So
Right.
that was one big challenge. The second challenge was to get the appropriate um, timely response from physicians, because during the COVID time, physicians were overwhelmed with
Right.
the services that were required. So patients may have to wait, and that sometimes create a challenge. The third thing was patients kind of a uh, doubt whether they can be served. But
Right.
when they were actually asked the questions, taken their vitals, and doctor came and did, then they say, oh, this is as good as seeing doctor in person,
Right.
and we can get a similar advice and care. So next time they say, can we see the doctor online instead of we going to
Right.
travel and go there? So those were the challenges, and of course the biggest challenge, Anchal, is to get donations and funding. We
Yeah.
have we have to go and appeal to the large audience for donation. Now, one great thing that we can do, and we want to bring it to the attention of all the um, uh, companies in India, all companies are required to have 2% of their profit devoted to CSR fund, which is corporate social responsibility, which mandated by government. Now, these funds have to be utilized within 3 years of the year that they were earmarked. And I think that amount can help us, that donations, which can be used for healthcare in India, can help us to expand. And my vision and goal is to create 10,000 such telemedicine visit sites over the next 3 years. So let's see the kind of success we get.
Hopefully, it becomes very successful in our rural
Thank you.
area. Yeah. So, why is the BHU conference is important for the future National Ideal Village movement for rural transformation? And do you have any message for the sponsors?
I have message for the sponsors. Please donate generously, support this cause, because it brings so much services to the people who need the most. At least your CSR money, you have to use it wisely. Look at the kind of services that we provide. Wills Global is an organization where we have about 25 to 30 board of directors. We donate our money, our time, and our talent to bring about these changes. There is no administrative cost. Uh, Everything that is donated goes to the services and the projects that we undertake. Also, your funds can be directed to your cause, like if you want to have healthcare or water and sanitation or nutrition or maternal and child care or energy or education. Any of these areas you can direct your funds, and it will be fully utilized for that purpose. So my message is, partner with us in the areas that you like, donate generously, and let's work together in partnership, in synergy with government to bring
Exactly.
about this transformation. I
Thank you
want
so much for taking the time and speaking with Data Quest and speaking with me. And your answers has been very insightful. And this conference is going to be a big success for the rural development.
Anchal, I want to thank you and your organization for helping us to take our message through cyber media to our country and globally. So I am personally grateful to you for giving me this opportunity, and to cyber media for making it possible for us. This is a cause which can only be achieved by generosity in time, talent, or treasury, anyone or always, and that's what you're doing. So, on behalf of Ideal Village Conference, Wills Global Foundation, I want to thank you, and we are grateful to you. Thank you, Anjali.
That's my pleasure, sir. Thanks a lot, sir. Thank you so much.